Hello, my name is Sasha Stratus. I'm a student physical therapist assistant at Jeff State, and today I'm going to be presenting my oral presentation on Case 2. Some of the patient history. The patient is a 59-year-old female, status post a right knee replacement 4 days ago. Total knee replacement, or TKA, total knee arthroplasty, is a surgical procedure in which parts of the knee joint are replaced with artificial parts called prostheses. The prostheses are attached to the distal portion of the femur and the proximal portion of the tibia with a plastic piece between them for cushion. Total knee arthroplasty is a widely used treatment for multiple arthritic conditions. She is weight-bearing as tolerated. And some subjective findings from her case are that she states that she has had a 2 to 3 year history of osteoarthritis, with her right knee being worse than her left knee. And another subjective statement was that she complains of symptoms with weight bearing greater than 5 minutes, sit to stand, sitting, and sitting with knee flexion. Here is a picture of what a TKA looks like on a knee. Okay. Some objective findings. The knee active range of motion in a supine extension flexion position is on the right is 15 to 70 degrees. On the left is 0 to 135 degrees. The patient's passive ROM, supine extension flexion, on the right is 10 to 75 degrees, and on the left 0 to 140 degrees. The right knee active range of motion and passive range of motion are both limited by pain, and the passive range of motion on the left lower extremity has a capsular end feel. Joint mobilization. The joint mobilization that I chose is patellar glides. The reason why I chose this is because it will remove adhesions, and the patient presents with edema post her surgery. So the patellar gliding will reduce some of the buildup of the swelling. The patellar glides, you can do superior, inferior, medial, lateral, and you can also do a tilt. And why I would do this, the subjective reason I would do this would be to decrease her pain, because once her edema decreases, her pain will also decrease. And as I said, it breaks down adhesions and also decreases stiffness. So I'm going to demonstrate that for you right now. Here's a right knee, and this also depends on if the patient can actually tolerate this. She may want to wait until another session to try it, depending on how her pain level is. I would still offer to do it, since generally this isn't a technique that causes a lot of pain. So to mob the patella, you can go medial and lateral. Medial, lateral. You can go superior, superior, inferior, superior, inferior, and you can also tilt to the sides, tilting medially, tilting laterally, just like that. If the patient would say that she is not having problems with pain, I would continue to do that joint mob. So, patient education. The most important thing for a total knee patient to understand is that they should never put a pillow under their knee. This can create a flexion contracture, and it will decrease their functional ability. We want them to keep their legs straight as often as possible if they're sitting down for a long time to get up, and like for if they're watching TV or something, get up at least every hour or 45 minutes and start walking around or stretching their leg. You want them to keep it straight as much as possible, and if they need to place a pillow or anything under their leg, they can place it right under their ankle, and that will actually help with the extension as well of the knee. Home exercise program. I chose the exercise ankle pumps because of the patient's edema. Now, I will have my patient demonstrate ankle pumps for you. If you could, hold on a sec. Bend your foot up and down at your ankle joint just as it's shown right here. And then I want you to do that 15 times, complete 2 sets, and do that twice daily. Okay? Can you show them how you do that? Okay? Yes. Just like that. Very good. You're going to do that 2 sets of 15. Okay? All right. Alrighty. So why did I pick the ankle pumps? Because it's a musculoskeletal pump that will help to shift the edema in the knee back into the body, the fluids, and it will help her decrease her pain once the edema has gone down. Prognosis. Will the patient return to a previous level of function? Not exactly. It depends on the patient and how hard they work and how much they exercise. But the studies have shown that 0 to 120 degrees of flexion extension is about the standard norm that a person can reach, and is a safe number to reach. So because her right lower extremity will get to 0 to 120 and her left lower extremity is 0 to 135 degrees, it's not going to be exactly the same. So it's not the same level of function as previously. Assisted devices. The patient came into the clinic with a walker after her surgery. While she was in clinic, she was using a straight cane. And when she came in for her second 2-week evaluation, she stated that she had spent several hours at home ambulating without a cane. So it is very likely that she will not need an assistive device for very long. When will this patient return to function? It takes about 6 months for the swelling to go down from her knee, and in about 6 months she should start seeing a big decrease in her pain and an increase in her functionality. And it just takes time and rest and ice and a good exercise ethic. All right. Thank you very much for listening.